Honorable Minister of Health, and all the dignitaries that are representing various levels, youth serving organizations, and the young people that are here, I'd like to stand on the protocol that has already been established. I start by thanking all the organizers of this conference, which has given us the opportunity to participate in one of the most important areas of work for the entire world, but Africa in particular. This conference provides us an opportunity to once again focus on the need for evidence-based implementation of policies and programs. And it is indeed very important for us to realize that we are working on probably the most important, most pressing health areas for the young people in Africa. The issue of nutrition and physical activity, sexual and reproductive health, and of course, all the related NCD areas we are going to be working on is very important for each of the countries that are here. We, as members of the think tank on youth and adolescent health in the Sub-Saharan Africa, pledge to embrace this initiative, which understandably is going to promote implementation of evidence-based policies and programs in Africa. Adolescents, as we've heard, adolescents and young people represent almost 40% in most of our African region. Uganda in particular is one of the youngest countries in the world, and so we are very happy to be part and parcel of this initiative. Adolescents are the present and the future of our various nations that we represent. And indeed, their health is the greatest area of investment that countries can make in order for them to realize the progress and development that they are aspiring to have. We realize that even within the broader development goals, we are a few years away from them, the 2030 goals. But indeed, for the young people, we go beyond what we have set ourselves for the 2030 SDGs. We will work to promote and share and document the evidence and support the convening of the various stakeholders that we need to be working with as members of the think tank, to ensure that countries in Africa can actually move from talking and documenting to actual implementation of policies and programs in order to make a difference in the lives of young people and adolescents. This is the time we have. God has given us this time in our continent to make a difference in the lives of young people. And we do believe in the lives of everybody, even the other ages. Because if the young people are not settled, they are not progressing, they are not working, then the nations are not progressing. So thank you for the opportunity that you've given us to serve. We will listen, synthesize, and gain consensus, and build strong partnerships for implementing good practices, high impact practices, because we know that at this time, the resources for health systems are really reducing overall, and we must ensure that what we set our eyes on is going to make a difference. Networking, and supporting various partners to ensure that resources are put in the right place for the young people and adolescents is what we all aspire. But if we are going to do this, we must work together with the universities, with the governments, with ministries of the various countries to realize and implement the consensus that we hope will be built. We thank you all for giving us this opportunity to serve. Thank you very much.